To our second keynote speaker of the day, and this man's involvement in wellness goes all the way back to 1981. He is the Director of Research at the Lakeshore Foundation, and he has such an incredible CV when it comes to this area. Please give a very warm welcome to Dr. James Rimmer.
Thank you, everyone. It's a delight to be here with you today. I'm sorry that we can't meet in person, but I feel very optimistic about the kind of work that we're doing together on behalf of children and adults and seniors with disabilities. So thank you for the invitation, and I look forward to sharing with you some interesting information and one project in particular that we're working on here in the United States. My background is I have been in adapted physical activity for 40 years at 3 different institutions of higher education. And I currently direct the National Center on Health, Physical Activity, and Disability. So with that, I'll go ahead and begin the presentation. The title of the presentation is Beyond Sport, Using All Forms of Wellness to Optimize Resilience Within People with Disabilities. And so the major focus of this particular presentation is to share with you some ideas on how we as adaptive physical activity professionals, wellness professionals, really need to begin to build out what we do so well in the area of physical activity and sport. My focus is to really get into 3 areas that I hope you find to be somewhat interesting and also relevant to what you do in terms of your work with disability. First, obviously, part of this is to make a strong case that as professionals, we need to be thinking about the bigger, broader area of wellness to complement the kind of work we do in the area of sport. Second part of the presentation is to discuss this new program called Mentor. And then the third part of it is to hopefully leave you with what we perceive would be, an international partnership in getting you involved in and trained in the Mentor program. Now, before we begin, many people often use the terms health and wellness interchangeably. For the kind of work we're doing here in Birmingham, Alabama, and through our National Center on Health, Physical Activity, and Disability, we make it very clear that health is really more of an outcome that you're trying to achieve through some type of wellness program. So health pertains to the outcomes associated with the program. For example, those of you who are working on increasing the behavior of children and adults with disabilities and engaging in sport and physical activity and fitness, your hope is that the outcomes associated with that will be related to perhaps weight management, a lower risk of cardiovascular disease, increased participation, et cetera, et cetera. Wellness is the actual set of behaviors that we use in order to improve, or in some cases, it could be impair health. So someone who is a smoker, for example, that's a behavior, right? It's not considered wellness, but it's considered a behavior that can impair their health. So what we're looking for are behaviors in wellness that can actually improve health. And there are many different domains of wellness that I'm going to go into in a moment. Now, the scientific rationale for wellness, and I hope that your country will begin to think of wellness as part of our discipline in adaptive physical activity, recreation, and exercise, because there really isn't any particular group out there who owns the word wellness and is making it a major part of their knowledge, skills, and abilities. So I think we've got an opportunity in the disability community to take wellness and own it and allow other people to come into our space in the area of inclusion and accessibility and understand how wellness can be applicable to the populations they're interested in. So as we know, many people who acquire a disability or are recently diagnosed with something like Parkinson's or multiple sclerosis never really make the transition from what I refer to as a rehabilitation patient to a wellness participant. So we've got to begin to think about how do we build in more wellness into the current healthcare system. Wellness is often impeded by a community that is underprepared to support health and wellness needs. In our country, the United States, there's a very large geographic area, which we call rural communities. And those communities very rarely have any access to health and fitness and groceries, foods that are healthy in nature. So we've got a big problem because of the geographic spread on trying to make communities more inclusive and accessible for people with disabilities, particularly in the area of health and wellness. And the emphasis in healthcare today is really managing, certain conditions. So, doctors and therapists have very little time to talk about wellness. They're very often in a crisis mode where someone is coming in with, a very high level of pain, or they have a level of depression that, is impairing their ability to live independently. The doctor and the healthcare professional really has to focus on those conditions. So there's little time to discuss wellness. And I think that's where we come in as professionals. Now, I don't have a lot of time to spend in this area, but you're more than welcome to get a copy of this paper, or we could send you a copy. And I think the key here is to understand that many, many people with disabilities have multiple physical secondary conditions. And you can just see from this slide, things like chronic pain, high risk of falls, fatigue, all of the red bars on the screen are showing the rates of these secondary conditions among people with disabilities. And where we could find data on those same secondary conditions in people who don't have disabilities, you can see that there is a disproportionately larger percentage of people with disabilities who have these conditions. And it's no different for the psychosocial secondary conditions. When we look at health concerns like anxiety, communication, depression, isolation, these are all dramatically higher in people with disabilities. And that's why we decided to build out a program using exercise and sport as the core foundation of what we do. We decided here in the United States that it was really important to build this out because there are so many conditions that exercise basically can improve all of these. It can improve a lot of them, and it does improve most of them. But there are other things in wellness that we can do in order to enhance the quality and independence of people with disabilities. And remember that our role as professionals is not to be a top-down model where we're telling people with disabilities, you need to do these things in order to get well. But what we're hearing from the disability community is that they want more than just sport and exercise. They want a lifestyle health promotion wellness program that will help them prevent or improve many of these physical and psychosocial secondary conditions. So why must we go beyond sport and exercise to get to our destination? We're going to still end up in the same place. Kara, I know, does outstanding work. My very good friend Pat Flanagan had me over in 2012, and I know you've got a comprehensive sports program across many counties in your country, and I think it's going to be the same thing here, that we want to see not only sport, but we want to add to that through various types of wellness behaviors. And an interesting book that I just read from our former Surgeon General in the United States, Dr. Vivek Murthy, is he's quoted as a doctor. I find this to be a profound quote. During my years caring for patients, the most common condition I saw was not heart disease or diabetes, it was loneliness. So we're seeing in our country, and also in the UK and other parts of the world, they're starting to track the data on people in general and people with disabilities in particular. They're finding that this area of loneliness is really almost at a crisis level. And when you talk about people, you would talk to people with disabilities, they'll tell you the same thing, that many, many conditions related to their life can be linked back to this pervasive area of loneliness. So obviously we need to begin to think about how do we build out wellness programs through sports that reduces loneliness. So we need to also think about transforming patients into participants. This is sort of a mantra that we use here in the United States, that we've got to get into the healthcare system, and Kara Sports obviously has a great opportunity to do that, but we've got to get into the healthcare system in the United States and really educate physicians and healthcare providers and therapists that their role is to ensure that when a patient leaves the rehabilitation setting or hospital, they really understand the importance of transforming themselves from patient to participant. When they leave that setting, that healthcare setting, it's incumbent upon us as sports exercise professionals to be able to take that warm handoff from the healthcare professional and get people engaged in community-based sports, recreation, and wellness programs. So the other part of why we decided to move from just sport to wellness is that we know that as much as we can possibly do with exercise, it only covers a very, very small percentage of the day for anyone, including people with disabilities. So, if you take, for example, someone who goes out and gets an exercise program, it may take up to an hour, by the time they warm up and they change into their clothing and they get to the facility. It could be 1 hour, maybe 2 hours, which increases that time from 4% to 8%. So there are many other things that we have to think about, as health professionals that someone needs to do across a 24-hour period. And that's why we built this program called Mentor, which you'll hear about in a few minutes. So what is the goal of Mentor? It's really to begin to think about building a pathway from healthcare to lifelong wellness. And the term Mentor stands for mindfulness, exercise, nutrition, to optimize recovery and resilience. So we use the term, the R stands for both recovery and resilience. Recovery being for those individuals who might be at a hospital, even children. We have many, many children's hospitals in this country. I'm sure it's the same way in Ireland and other parts of the world. The child may go in to have a tendon lengthening if they have cerebral palsy, or they could have some other kind of health issue that requires minor or major surgery. And once they get out of the hospital or they get into rehabilitation, they begin that recovery process. Resilience is a little bit more about the individual who has not access to healthcare system for a period of time and is really in need of a program that helps them build resilience, which has a lot to do with maintaining the body's equilibrium. So people who have good resilience are able to adapt to a new lifestyle that they may have. They're able to sort of roll with the punches. If there are issues in their life, they have mechanisms to deal with them. Mentor has a couple of program highlights. One in particular is we use the term precise or precision-based. You may have heard the term precision medicine. We're starting to use the term called precision wellness. We could even put the word inclusive in front of it, inclusive precision wellness. But the whole idea here is that we now have the technologies available where we can begin to look at how do we build more precision or tailoring into the kind of programs that we're offering. Mentor is also on-site and online. We started this program last year, but when the pandemic hit in the United States in March, we had to shut it down, and we moved everything onto an online platform. As I mentioned earlier, we separate health from wellness. So the definition for us of health really encompasses 3 dimensions, and that includes mind, body, and spirit. And what we're hoping to do, the goal of Mentor, is really to provide participants. Children are not as at this point engaged in Mentor, but we're hoping to build this through one of our excellent expert information specialists, Alex Martinez, to build a Mentor type program for children with disabilities who are also in great need of something that's more comprehensive than just sport. So our goal here is to improve their self-management skills in order to allow them, people with disabilities, to optimize their own health and function. So we don't want any kind of a top-down model here where we're doing all the work for the participants. We want to give participants the tools, and we want them to be able to self-manage their own health. And finally, the whole concept of what we do in exercise and sport and other areas of wellness is really to look at 3 dimensions of this. You want to build in some kind of restoration for people who have been sedentary for a good part of their lives or are in need of a intensive rehabilitation / wellness program. That's more the restoration side. And then from there, you want to get into the dimensions of improvement. And finally, once they get to a level of improvement and they start to level off, then we can get into the prevention mode. So Mentor was created to empower stakeholders to manage their own health, people with disabilities, to complement the world of precision medicine, to stop underselling the importance of a multi-dimensional set of evidence-based wellness domains. There are a lot of things that we could be doing as professionals that we're not doing currently, and to help patients achieve the highest level of health improvement and protection when they're in the hospital setting. So we're hoping that here and maybe perhaps in Ireland, there will be opportunities where we can access the healthcare system, get into the healthcare system, get health professionals to understand what we do on the sports, exercise, recreation side of this, start to train you as health coaches so we can build out sport into these other domains of health, and then at some point make that seamless interaction to get patients to become participants in programs such as yours. And finally, we want to provide you as sports exercise professionals with a connection to wellness. So who is Mentor for? Primarily, we have three groups at this point. It doesn't mean that we couldn't increase it or expand it to other areas, but right now we're currently working with patients who have been recently diagnosed with a condition like Parkinson's, multiple sclerosis, amyotrophic lateral sclerosis, or ALS. People who have a recently acquired disability, such as a spinal cord injury, a stroke, traumatic brain injury, and of course, anyone who has a secondary health condition, such as depression, anxiety, excess weight gain, a new level of pain that requires healthcare, whatever that may be, we certainly want to work with anyone who has a disability. So basically, it's opened to any participant who's interested in wellness. They have a disability, they may be having a secondary health issue, or they have been recently diagnosed with a new disability. Mentor has 11 evidence-based wellness domains, and we use the acronym MyScorecard. So Mentor is composed of mindfulness, which we refer to as minding your thoughts and emotions, your spiritual practice, self-care skills, core values, outdoor time and nature, relationships, exercise, contribution to others, arts and leisure, rest and relaxation, and diet. The major components of Mentor are mindfulness, exercise, and nutrition, which is why we start with MENTOR. Those are the three, what we refer to as the core wellness domains, and then the other 8 wellness domains are also an integral part of the program, but are given a bit less time in terms of training participants on how to manage those domains. Now, I also want those of you who are attending this presentation online from Ireland and other parts of the world, perhaps, and even the United States, that Mentor is currently housed at Lakeshore Foundation, which is a large nonprofit, not-for-profit, universally designed exercise facility for people with disabilities. It's an absolutely amazing place, and I would like to invite any of you who are very interested in looking at a universally designed facility, perhaps one of the top facilities in the world, to please come to Lakeshore or get online, lakeshore.org, and give this wonderful facility a look. Lakeshore is obviously known for competition. They have programs such as power soccer, wheelchair basketball, wheelchair rugby. We're the home of the U.S. Olympic and Paralympic training site for wheelchair rugby. So it's it's a place where we have the capacity to build out sports and exercise programs, but we also recently added on a very large universally designed facility that involves more of the wellness components. This is an example of our telenutrition lab. So we have the capability now to actually teach people with disabilities different types of recipes or cooking behaviors that they could transfer into the home. And they can actually do this now through live video conferencing capabilities anywhere in the United States or world. So we do a lot of nutrition. We have a full-time nutritionist who teaches people with disabilities at this point remotely how to develop recipes and foods that will improve their health. So how can you get involved? Really, your primary role as a health coach, if you decide that mentor is something you're thinking about or interested in, is to be able to teach your participants critical wellness skills that will allow them to self-manage and optimize their health and function across their lifespan, which we know is a strong complement to sport. So we think that the wellness domains that I mentioned previously can be built into your sports program and offered to people with disabilities. You could even do it in a menu fashion where someone could come in and say, you know, I'm more interested in mindfulness than I am in spiritual practice. You know, can I take an online class in, you know, understanding a bit more about one or more of these wellness domains? We have an online health coaching platform called Rise. It is absolutely amazing in terms of its flexibility. It gives you all the information you need as a health coach to be able to monitor the performance of your participants. We have a number of different self-report and physical function assessment tools that are posted on the website. It allows you to track as a health coach your participants' behavior. You could do pre and post testing. It has a whole goal setting section. It provides participants with regular updates. It could be hooked up to text messaging, so you could send your participants messaging. It's very, very usable, portable, and robust. There's also a section which we refer to as the Get Healthy platform. There's a participant portal, so participants can actually see the types of food they're eating. If they want to look at a graphic of foods that they've eaten across a period of time, you know, they get a chance to input whatever they'd like in the area of food, exercise, what kind of workouts they're doing, and the program will automatically develop the data into a graphic form that they can use to look at their behaviors across time. As I mentioned at the beginning of the presentation, this is all part of our National Center on Health, Physical Activity, and Disability. So please, I hope you get a chance after the conference to get on the NCPAD website and to look around and see if there are things that you can use to help build out or advance or improve your program. And just in terms of a summary, let me just mention that the concept really here of mentor is to build out this area of self-care rather than expert care. So we want people with disabilities in our country and as well as your country to understand that they manage their own health, and they need to tell us as health coaches, you know, what are the areas that they need in order to allow them to live independently and hopefully reduce their risk of, you know, various types of chronic diseases such as obesity, heart disease, diabetes. The overarching goal of Mentor is to teach participants a broader lifestyle of wellness. We think the three ultimate outcomes are transcendence, which really has to do with the whole nature of the spirit, optimism, which is teaching people to, quote unquote, roll with the punches, be able to adapt and reboot when a certain event occurs in their life, you know, to continually look at the optimistic side of life. So we think that's a very big part of this, particularly in the area of mindfulness and spiritual practices. And finally, resilience, which is the physical nature of the individual's body being able to recover from an injury or a new disability or a new secondary condition and adapt according to, you know, this new area of function or health that they're engaged in. The second point is we've been hearing a lot from the participants who have gone through the Mentor program that one of the most interesting areas they're finding in this is this area called mindfulness. We have many, many good videos on the NCPAD website that show people with disabilities how to engage in mindfulness. So please take a look at that on the NCPAD website. But we find this to be a major part of Mentor, that the individual actually increases their awareness of the present moment and practices what we refer to as breath consciousness. So we were really surprised to learn from several of the participants that they find this to be the most important and interesting area of the mentor program. We also do a lot of nutrition. So, obviously our hope is to increase nutrition knowledge and also to improve their eating behavior. And then finally, exercise, which is helping them develop a program that is transferable into the community or home. So the broad goal of Mentor as well, in addition to mindfulness, exercise, and nutrition, is to encourage people to spend more time outdoors in nature. We find nature to be very, very important to optimize in health and function. Also taking care of oneself through self-care, which we define as physical self-care, maintaining good bladder, bowel maintenance, checking their skin periodically, engaging good oral hygiene. We also refer to self-care as psychosocial self-care. So we want to teach people with disabilities how to advocate for themselves and increase their self-determination. That's also an integral part of the program. Rest and relaxation, also extremely important. Many people that we have encountered have sleep disorders, sleep apnea, or they have a level of anxiety that makes it very difficult to sleep at night. So we have a whole section on improving sleep habits and getting rest across the day. And then finally, we also work with participants on establishing their core values. The core values being what do they want to do from a wellness standpoint to build the core out that will protect them from various chronic health conditions and also optimize their health and wellness. Finally, Mentor's ultimate outcomes are obviously to increase physical activity, improve healthy eating, reduce stress and anxiety through mindfulness, prevent health issues through good personal self-care skills, find one purpose in life through the spirit-based dimension, and build strong and vibrant relationships with family, friends, and communities. So the portal for wellness for people with disabilities is really to look at it this way. There is a small window of opportunity when an individual with a disability or chronic health condition recognizes that the elements of wellness may become a portal to recovery. And in many respects, the most effective way to do this is to immerse the individual in a culture of health, wellness, and optimism, surrounded by a highly qualified staff and other individuals who are experiencing a similar set of circumstances in their life. And so I didn't mention earlier that our mentor program consists of 5 to 8 participants with disabilities. And what we're learning from that group-based online wellness programs is that the interaction of participants within each other and within each group is really starting to build new relationships and is helping the individual reduce this pervasive level of loneliness and isolation that we've seen, particularly during this time of COVID-19. So finally, I would like to thank you personally again for the invitation to speak to your audience today. I would like to leave you with one of our outstanding expert information specialists, Alex Martinez, who's a member of your group, can be reached at alexm@lakeshore.org through our National Center on Health, Physical Activity, and Disability. So if there's anything you'd like to know about the mentor program, wellness, what our National Center has to offer, if you'd like to be trained as a health coach, or you'd like to get involved in some of the area of inclusive health or community health, please feel free to contact myself or Alex Martinez. And with that, I'll stop there and say thank you, everyone. And I hope that someday we can meet each other in person. Goodbye.